Hi again, this is Jim Rush, and one more time we're going to do another presentation on areas of emergency management and disaster preparedness. This time I'd like to talk about a concept that I've been advocating for many years now. When I was in Germany, I served at the United States Army Medical Materials Center, Europe. And what that was a depot level, very large installation where we had mobile hospitals, we had combat support hospitals, we had deployable medical units, we had a number of medical assemblages along with all of the equipment and the supplies that went along with that, as well as a personnel component that we called a med-som. So when we sent the assemblages and the med-soms out with all their supplies and equipment to 1991 Operation Desert Shield, it was prior to Desert Storm. All of those assemblages went out, as did the personnel and equipment and supplies, onto Saudi Arabia, and it was magnificent to see the plans all come to fruition, to see the people fall in on the hospitals, and to see the healthcare being provided to our wounded. And so I fell in love with that kind of idea, and I said there's got to be a way we could duplicate that in the civilian sector. And I came up with what I'm calling the National Medical Readiness Center. What is it? Well, it's government owned, government financed, but it is contractor operated. Now these facilities, there are many, by the way, this is not the first time, but they're called GOCOs, government owned, contractor operated. And it would have a number of assemblages, and we'll talk about some of those. It would also include support equipment, the maintenance staff, and the supplies needed to sustain healthcare activities on deployments anywhere in the world. And it would also include healthcare providers, and that could come from the National Medical Response Teams and the Medical Reserve Corps. Units could fall in on that, on those assemblages. So when we say government-owned, contractor-operated, we're not talking about a small operation. This would be a very, very large operation, and I don't have any relationships with any of the people, any of the companies I'm going to talk about briefly, but I'm talking about companies like SAIC/Leidos, Raytheon, General Dynamics, Boeing, and maybe Northrop Grumman, and there's others. But these companies have the corporate debt, they have the resources, and the track record of managing large-scale national programs. The way it would work is when a jurisdiction leader requests a medical assemblage deployment, the Readiness Center would send a bare base team. I'll talk about that in a minute here. But basically, the bare base team would go out to prepare the project footprint to make sure that we don't send assemblages out there when the ground is not prepared to receive those assemblages. They also then, once the advanced team, the bare base team, sends back that everything is ready, then they send the medical assemblages, the care providers, and support staff to maintain all deployed assemblages and medical staff to support the medical activities. After the deployment, the Readiness Center staff would decontaminate and return assemblages to the National Medical Readiness Center, and that's where all equipment would be inspected, recalibration would take place, and repair if necessary, and then the equipment would go back in storage for the next disaster. So the concept of bare base was, in the past, I think first time I heard that was in the Air Force when I was stationed in Germany. But the idea was that you could have just a plot of land, and you could build a complete base on there with all of the infrastructure needed to provide operations. So it's basically, we come with everything that we need, and that includes things like water purification, waste processing, sterilization equipment, everything that we bring in there. All the assemblages would be of industrial grade or military grade, and all the assemblages, the hospitals, the trauma centers, the burn centers, whatever they be, they would all be proven at the proving ground for what they call the Army's Natick Soldier Systems Center, and approved, basically a proving ground for equipment that's going to be used by our people in the armed forces. Now, during non-deployments or periods of calm, when there are no deployments active, then we would have time to provide training at the National Medical Readiness Center for people from the National Disaster Medical Teams, from the Medical Reserve Corps, and these folks would be able to maintain their competencies. Just again to touch on the kinds of assemblages, the facilities part, mobile hospitals themselves, which could be a surgical hospital, kind of like what you saw with the MASH units, the Mobile Army Surgical Hospitals, they were called. But these are the next generation. These come with air conditioning and heating bladders, and they come, of course, with their own power sources, their own generators. But it would be also trauma and burn centers, ventilator support units, ICU, pediatrics and geriatrics, public health departments, and of course sleeping quarters, cafeterias, and latrines. The mission support equipment, it would include power production equipment, long-running generators, not intermittent generator support. These would be production equipment, power production equipment that could run for weeks and months, need be. Water purification units, water processing equipment, sterilization equipment, food service units, communications equipment. The staff that would fall in on any of these mobile hospitals, mobile assemblages, would be the care providers themselves, equipment maintainers, medical material staff, security staff, and communications people. So that's basically a 20,000 foot view of what we could have available to be deployed anywhere in the world, but nationally or internationally, at the direction of the government. So I hope that in the future, those of you who basically review this presentation will have at least an idea of what is possible, and hopefully someday we'll achieve that. The benefit to the people, the number of people we could save, the numbers of people we could treat and alleviate their suffering, be hard to put a value on that. But I believe with all my heart that the National Medical Readiness Center, that's well run and well trained and preserved, will be the very best emergency management care system that we had since the days of the 1950s and 60s, when we had the civil defense days. We did have hospitals then, and they unfortunately fell into irrepair and were basically just disposed of. And hopefully the Medical Readiness Center would have the equipment, supplies, the personnel, and it would have the support of average Americans to know that we have a resource that we can deploy anywhere needed in the world to save lives and reduce suffering. Thanks an awful lot for attending this presentation, and I'll be talking to you as soon as I put my next one up. Thanks again.